Hello, viewers. Welcome to APO Talk. This is Ji Suyun from APO, and we are broadcasting from Tokyo, Japan. APO is an intergovernmental organization with 21 member economies, and APO serves as a think tank and provides consultancies to promote innovations and productivities and competitiveness. For more information, please visit our website, APO, Asian Productivity Organization. And today we're going to discuss the public health and leadership under the time of pandemic. So we've heard of some measures to combat COVID-19 from the media, but the gist will be understanding the organically integrated public healthcare system and government leadership that accelerates agility under emergency. And now the question is how? How do the governments, related organizations, and hospitals, they make swift decisions and procure the medical resources on the right timing? And some exemplary cases acknowledged by the WTO is the RC and RK. So today we invited two speakers from the countries. Dr. Won-jae Lee, he is a professor physician at Seoul National University Hospital, a leading institution in Korea, and he was also a consultant at Boston Consulting Group. And Ms. Andrea Yang, she's a consultant for members of parliament in RC. She has held various governmental positions, including the director post of the public and media relations, and led other areas such as the government strategizing and policymaking, lawmaking process. They will share the detailed, innovative, and easy to understand information for viewers from outside and inside the healthcare sector. So stay tuned for details of the two countries' interesting stories in challenging COVID-19. Also, we're getting questions from the live chat for the Q&A session later. So please leave your questions with your name and organizations in the live chat box. So before we start, may I invite Dr. Lee and then Ms. Andrea to say hello to our viewers?
Hello, it's my honor to join this talk today.
Good afternoon, everyone. Thank you, APO, for inviting me to the talk. It is my pleasure to share a bit of experience from Taiwan.
Okay, it's very nice meeting you today. So Dr. Lee, can we start with your presentation then?
Yeah, sure. Would you put up my slides then? All right, so my name is Won-jae Lee from Seoul National University Bundang Hospital. I'm an interventional cardiologist, and I'm going to keep talking about our national system to fight with COVID-19 and introduce some of stories of Daegu Gyeongbuk case, which was a huge outbreak in our country. And I'll spend some time for introduction of our in-hospital management system. So before we begin, I'd like to talk a little bit about overview our Korean healthcare system. So basically, we are under one-payer system. Governments hold strong power, and they have set up national health insurance service. So basically, all the people in Korea get universal care. And at the same time, our hospitals and clinics, all the medical facilities are under the control of government as well. Although 90% of these are 90% private, but they're under this national health insurance service. So the control is there with the government. So while we're having this private system, having efficiency with high quality, also government has strong holds over the entire healthcare system. So what happens under this kind of endemic situation? So under the alert level yellow, which might be, let's say cautious, then we have a KCDC under the Ministry of Health and Welfare, and Deputy Minister will be in charge for the situation. But once alert level goes up to red, which is, let's say, severe, then government sets up a National Disaster and Safety Status Control Center, and it will be governed by Prime Minister, and KCDC will be under the control of Prime Minister at the time of crisis. So with this this organization, what our government is that they set up rapidly with these screening centers. So there were more than 600 spots across the country which are both public or private. So as you can see on the top left, these are screening center in front of our public health facilities, but rest are actually the screening center in front of private hospitals. And I think a lot of people already heard about drive-through screening centers. So this was very set up to expedite the number of testing. So it's very fast, but at the same time, it's very safe because it can limit exposure of front-end workers to virus because their contact is very minimized. And then we actually set up 70 spots across the country, and you can just search them if you go to the KCD website. But just having these screening centers will not tackle the problem. So the other thing that we did was that we had a fast introduction of diagnostic kits. So in fact, there was a private company which developed this COVID-19 test kit just in 3 weeks. But these medical kits, you need an approval process. But luckily, we have set up an expedited approval process after MERS incidents, which will enable government to approve these new kits faster than usual. So at the end of February, there were more than around 5 companies who got approval for the government, and we were able to do more than 20,000 tests per day. And also, there was a fast and thorough contact tracing. So basically, public health centers has is the investigating agency, and these EIS officers will start investigating once a COVID-19 patient is identified. They make contact lists in the system, and they notify local jurisdiction, so the close contact can be detected as well. And also, we identified patient movement by using GPS, DUR, or credit debit card user data, so that even patient might not remember everything, but we're able to track their whereabouts. Of course, there are some concerns for the privacy issues, but after MERS era, we have set up Infectious Disease Control and Prevention Act, which would enable for government to collect these data. And there was a restructuring of medical facilities. So these kind of endemic happens, just having this expansion of beds is very important. So although we don't have that much public hospitals, but for this infection, we have set up national infection control hospitals. So basically transformed public hospitals for COVID-19, and then transfer patients who are having different problems to other hospitals. And the other is safe hospital. So this kind of infection is important, but we cannot just miss out other usual care as well. So government designated safe hospitals around the country, which have a system and the personnel which can have the system where patient with respiratory symptoms are isolated from the other patient through the entire care process. I'll go a little bit in detail by introducing our hospital system. And also there was expansion of negative pressure facilities. Of course, there was a building of units as well, but we need faster expansion. So we used portable environment containment unit and to transport general wards to these negative pressure facilities. And the last thing is community treatment center. So this is basically a non-medical facility, and this is repurposed corporate training facility by the help of private entities. So basically, this is for management and treatment for mild cases. So for example, patient who can discharge from the hospital, but with RT-PCR still positive. So these patients do not need any medical care, but they still should be monitored, so they're put in these centers. Or patients are asymptomatic, but have comorbidities which put them higher risk for severe cases. So having this community treatment center, hospital beds could be unburdened. This is one example. So actually our hospital, Seoul National Bundang Hospital, participating in the running this one of community treatment center. So on top left, that's the control center in our hospital. And down the right, you can see that operating center in that non-medical facility. So by telecommunication, we could do patient care when necessary. And these are some facilities that were used. So we have X-ray machines as well. And on the top down left, that's the room that was provided for the patient with COVID-19. So basically, tertiary hospital take care of severe cases with these high-level isolation units, and if they get better, and they're going to be sent down to these treatment centers until their COVID-19 they test negative for COVID-19. And public and private hospitals, they also treat COVID-19, but when they need health and their cases get severe, they can send their patient to our tertiary hospital for further care. So let me spend just a little time with the Daegu Gyeongbuk case. So many of them might have heard this Sincheonji Church. It's this cult, and they were at the center of this outbreak. Basically, they had a huge gathering in Daegu with a lot of people just sitting very tight together, singing and chanting together, and the virus just spread quickly. So you can see that there was a huge surge, and daily diagnosed patients even went up to 700. So our government quickly shut down all the churches of Shincheonji, and also they started thorough testing of all the people of Shincheonji for COVID-19. So Prime Minister was stationed in Daegu right away, and our disaster center sent down rapid response team, and there was a special support team from government consisting of all the ministries, so we could make faster decision and also implement policies fast. And screening centers were increased, and expansion was bed capacity was done. So as I explained earlier, public hospitals were transformed to national infection control hospitals, and luckily there was one tertiary private hospital who decided to dedicate the old building for COVID-19, and actually it was a very, very important thing to tackle the situation. And also there was a community treatment center was set up to care of the milder cases. How about medical personnel? So public doctors, military doctors, and nurses from the country were sent down, but it wasn't enough. So government called for volunteers for all the country, and in a week we could see thousands of nurses, doctors, and other healthcare professional who wants to volunteer in the Daegu Gyeongbuk area. So there was strict social distancing, but without lockdown of the city, we were able to flatten the curve as you see here. But one other thing I want to stress on is that there was definitely strong government leadership, and there was huge support for private sector support. But I want to just stress on civic awareness as well. So there was no lockdown, but you could never see any exodus. They're just staying their home. They're not moving to other part of the country where they can just reach just one hour with the car or bus, but they just stayed home and just follow the government policies to tackle this situation. Let me move on to some of our hospital systems. I talked about Safe Hospital a little early on. So basically, this is a picture of our hospital, and all the patients are screened at the gate. And then we have something called COVID-19 clinic just outside of hospital, and also there ED triage in front of our emergency department. So basically, we are able to have patients with respiratory symptoms are isolated from other patients during the entire care process. So patients are all screened at the gate. If there are symptoms, they're going to be sent to either triage to ER or COVID-19 clinic. So this is a picture of our hospital. So there is a questionnaire just outside of entrance, and they're going to have a temperature check at the gate. And they're going to submit this paper here, and our staff will see them and evaluate, and they're going to just pass them, or they're going to send them either COVID-19 clinic or ED triage. So this is just example of our questionnaire and entry card. So what happens in the clinic for COVID-19? Anybody is suspicious of COVID-19 will be sent to this clinic. And if they're really suspicious by the doctor, they're going to do COVID-19 RT-PCR, and then they're going to be sent back home. But if not suspected, they're going to get they're going to get confirmation card, and they can just get usual outpatient care, or they'll return home if they're just need it's just simple prescription refill. This is a picture of our COVID-19 clinic. So just right out of hospital, clinic is set up with X-ray facility, and of course, clinics are equipped with negative pressure facility. And this is in front of our ER. There's a 3ED triage, and this is 24-hour screening. If they're not suspected, they're going to just go into our regular ER. But if there's something suspicious, they're going to be sent to isolation area. What happens if they need admission? So in our hospital, we have three different words for COVID-19. So the first is high-level isolation unit, which is for confirmed COVID-19 cases and who has severe symptoms. And one is a renovated isolation unit, which is actually renovated the unit for this special situation and therefore more moderate cases. And we also have a preemptive isolation unit, which I will go into detail a little later. So this high-level isolation unit is actually set by under the government mandate. So after MERS era, government set all the negative pressure isolation word around the country, and we have 9 beds of them. So this facility is completely has a completely separated pathway from our main building, and we have as here we have separate entrance. And you can see we have the central monitoring here and PPE donning and doffing room equipped. And you can see the huge room with negative pressure where you can put ECMO or a ventilator or CRRT when necessary. And this is our renovated isolation unit. So as the number of confirmed patients increase, we had to use another word for COVID-19. And last is preemptive isolation word. This is sort of a unique one just to tackle this situation. So basically, this is not a word for confirmed cases, but suspected or high-risk patient. So for example, in this area, this is room for patient who has a respiratory symptom and who have high epidemiologic risk. But until they're COVID-19 positive, they'll be sent here. And this green area is for people who has atypical pneumonia but tested COVID-19 negative. And this area is for patient has high epidemic risk. Let's say people from Daegu during their endemic, but they have come for other reasons like chest pain or let's say a diarrhea. Then they're going to put in this area until they test negative for the COVID-19. And during this COVID-19 situation, we do telemedicine as well for temporarily. So our doctors will call the patient, and after consultation, we're going to send the prescription to the nearest pharmacy of the patient, and patient will easily get their medication. Of course, we are doing regular cleaning and disinfection of our hospital by specialized company. And this is actually a picture of our cafeteria. And I'm not sure you can see clearly, but we have blocking panels. And then we have assigned lunchtime to spread the use of this facility. Of course, now we're doing all the conferences and meetings in teleconferencing, and more stricter social distancing is required for our staff. And we have done a lot of education for PPE donning and doffing, and we're doing simulation for CPR and also to carry patient with a COVID-19 positive. So this is pretty much I prepared for the presentation, and I think we're going to have more time for open discussion later on. So thank you for listening.
Thank you, Dr. Lee. That was very informative. For the questions about the presentation, we're going to handle it at the later part of the webinar. At first, we're going to have a comprehensive understanding of our scenario in advance, so that we can have more in-detail discussion later. So now let's move to the situation in our RRC for the government's leadership. So let me invite Ms. Andrea for this. So Ms. Andrea, we saw the actions from the medical parts in RRI, and now we are wondering the government side. How is the RRC government responses so far?
Right. Okay. Thank you, APO, for inviting me again. I'm Andrea from Taiwan. COVID-19 is an unfortunate global public health crisis. While the world is still suffering from the outbreak, I believe that we still have much to overcome in the future ahead. We will not survive without the international collective efforts and possible mechanism to beat COVID-19 together. Like what Dr. Lee has shared, similar to Korea, we are lucky to have a strong national health secure insurance system, which makes an important difference during time like this. Our life goes on as usual, no shops or schools are shut down. I'm asked to provide a brief overview on the role of the government, which has helped Taiwan to contain its certain atypical pneumonia outbreak. In 2003, the SARS outbreak took us 73 lives, and with 346 confirmed cases, including the loss of the frontline medical experts. They were outstanding, courageous, and will always be remembered for their noble sacrifice. It was hard and painful lesson learned. We certainly don't want to repeat the same tragedy again. So since we are excluded from the World Health Organization, we realize that Taiwan urgently need to encounter the need to develop a model system that allows us to fight against certain pandemic disease like SARS or COVID-19 today. Such situation is considered a war situation that would jeopardize our national security and well-being. The CDC is the fully authorized commanding government body to make direct report to the premier and also the president when pandemic diseases outbreaks occur. We are also very lucky to have former Vice President Chen Jianren to be in the government. He was appointed to be the Minister for Health and Welfare during the SARS outbreak. He has contributed tremendous professional and empirical knowledge over COVID pandemic spread, together with thousands of medical experts and officials. For years, our government has met several law changes together with the parliament. We held civil drills, developed standard operation procedures to strengthen the system. The system is designed to monitor unusual, suspicious, and certain pandemic transmittable diseases around the globe, and to provide timely information to the decision makers and the country's leaders to make rapid and effective response to prevent possible spread, and also to provide absolutely transparent information to ease public panic. Now that's very important. Government efficiency and effectiveness extremely crucial and significant during the outbreak. The system is built and led by a highly professional team. They keep a close eye on the global health variables. The team was established after SARS 2003, and it was one of the medical experts recruited by the government after SARS. And he was the first person detected online discussion over unusual atypical pneumonia cases in Wuhan. And he immediately hit the alarm as early as December 31st, 2019. We tried to reach out for more advice from WHO, but with absolutely no information in return. The central government then need to prepare to implement required measures into epidemic prevention system prior to any cases was confirmed within our border. By activating this system means we need to ensure the best alignments of government at all levels. We need to optimize border control, screen inbound passengers' temperature, digitizing the personal information filling upon their arrivals, enforce 14-day home quarantine, mobilize healthcare system. The CDC officials met sure at least 20,000 isolation room with 14,000 ventilation stand ready for emergency. We need adequate medical supplies and materials that include an early awareness of face masks for all, and also sanitizing alcohol. We need quick travel alert and provide transparent and truthful information to the public. We need to enforce social distancing, and we need to build and utilize high technology system to assist us to increase sufficient communication and daily needs. And we also need to ensure public transportations and hospital communities infections not to be the weak link of the epidemic prevention. And of course, we need to do economic impact assessment, learn from SARS. We need also rapid research and development skills on the diagnose methods, antivirals, and vaccines. And we need domestic international cooperation. To name but a few, there is a hard and complicated we need to survive list. None of this can be done without demanding and depending on the government's efficiency and effectiveness. I will show the video that we made in Taiwan, and if you might please play the video for me.
Okay.
Right, thank you. This video on screen will hopefully give the audience some visual understanding of what we have done over the past few months. You might refer to it while I verbally go through the government's quick response and measures. The actions taken in January and February 2020 were crucial. On January 5th, an advisory committee on atypical pneumonia in China was organized by CDC. On January 7th, travel notice for Wuhan raised to level 1. It was 7 days after we found the cases. And on January 12th, experts were sent to Wuhan to obtain further information and conduct investigation on the outbreak, physically to China. On January 20th, we published multilingual educational materials on COVID-19 prevention measures. The Control Epidemic Command Center, CECC, then was activated by the CDC. So it's 20 days after cases identified in Wuhan on January 21st. We had our first case confirmed. That's 20 days after the first case was found in China. The next day, we started to ban group travels to China's Hubei, and banned tourists from Wuhan from coming into Taiwan. On January 22nd, President Tsai Ing-wen held a national security emergency meeting right after the first case was identified. Then 23rd, CECC begins to hold daily press conference to ensure the public have access to all information they need through all possible channels like TVs, radio stations, YouTube, social network, and all other communicators. On January 24th, exports of face masks are temporarily regulated. On January 25th, a system created in 3 days provide access to any Wuhan-related travel history through our national health insurance cloud system. On January 29th, communities are mobilized to help prevention of COVID-19. Digital fencing tracking system is built to keep track of the isolated and quarantined individuals at all time. And of course, we also ensure the individuals receive kind cares and supports from the officials and also the communities. We care about their psychological conditions, and there is a special hotline open for mental and medical consultations. So after people are being transferred from the airport to their home, there's also a set of SOPs to ensure they are protected during the transportation. All right. Early February, we active strict border control, and had to temporarily stop all nationals of China to enter Taiwan, and later Macau, Hong Kong, and to all foreign nationals in mid-March, as the spread went global and seemed to be out of control. So we think collective fear and panic are transmittable, and it is our worst enemy during the outbreak like this. So the government has to try really hard to not to let it hit us before the virus does. I want to mention and emphasize that we built a national mask production team and assemble resources like raw materials, technicians, manufacturers, business leaders, and government officials all together to form this team to make sure that the production lines are ready for use. We do this hand in hand, day and night, to increase the prevention level and accelerate all possible measures. Last but not least, we not only ensure sufficient masks are produced and distributed to citizens, residents, travelers in need, but also we need to make sure the price stay affordable and stable. We now have more than we have more than 90 production lines. The productivity went from 1.8 million masks per day in January to 20 million ones per day now, which is 10 times faster than 4 months ago. We have this system that people can actually purchase or donate their mask quota online. It was hard to come up with a fast and distributed system at the beginning, but we made it through. Now our confirmed cases stay at 441 for a long while, and with 7 people dead. We believe the system that we built after SARS made at least a foundation to contain COVID-19 today. In sum, I would like to mention there are 6 pillars to support the system. That is rapid mobilization, swift decision-making, precise implementation, coordinated resource distribution, transparent information, and advanced technology, as I might quote our Vice President's word. So finally, I would like to give a big thanks to people like Dr. Lee, who joined this professional medical team inside or outside the government and take us through this hard time. And I believe there are much more challenges lying ahead, and we cannot be too optimistic about the second wave. But let's hope for the best and do the best, and to make sure that we survive from this pandemic, this outbreak. I'm running out of time for the very important international collaboration, but we'll come back to that later. Mm-hmm. Thank you.
Okay, thank you very much for sharing the detailed information. The situations in RK and RC countries. And now I'd like to ask some questions to both experts, because after listening the stories in RC and RK, they had similar experiences before. In RC, you said you had established the system since SARS in 2003. And in Korea, in RK, you have a similar organization which is called KCDC, Korea Center for Disease Control. So both countries have the infectious disease events in the past, and then they prepared something to be organized for this pandemic, for this timing. So can you describe further in terms of this? Can I ask Ms. Andrea first?
Right. After SARS, there's so much we didn't have CDC before, right? Then after SARS, we made a lot of legal changes and try to build up a sustainable system. Then and we review our national insurance system as well. But this challenge is entirely new because the situation is a lot severe than SARS before. But we are successfully contain the number of infected cases, not just because of the past experience, but we need to develop new experiences to overcome any possible situations or sudden unexpected conditions. So I think that this system is a rolling system that would need to change over time, and we build up a system with some standard procedure of operation, but need to leave room for flexibility and need to ensure the commanding center has the full authorization from the highest government, and we need to have the most professional team that politics alone that let them be in charge of a time like this.
Yes, I heard the CECC is the organization that does the daily briefing on TV every day, right?
Yes, yes. It's important that the Minister for Health and Welfare, he personally be on TV to share transparent and thorough information to the public at a fixed time. At the very beginning at the early stage, we even need to have more than one press conference just to comfort the public worries and also to answer the media's inquiries. And it was very intense, but I think it plays a very important role to make the public trust the government and follow the government's instruction.
Okay, could you explain about this video?
This video plays on TV all the time. Have different medical experts being on TV or different channels. We have various versions to educate the public on the how do we fight this epidemic prevention. How do we work together with the epidemic prevention system? And you need to follow the clear instruction, and the instructions are very succinct and easy to understand. This will be played on television, YouTube, and other social communicators like Line or the Facebook, just to ensure that the public receive the instruction in all possible ways. And this is a hotline. If you have any queries, to dial 1922, then you would receive required information.
Yeah, so we believe that this is one of the ways to attract voluntary cooperation from the public to increase to increase their awareness. So how is the situation in RIK, like in terms of the institutional infrastructure from from the experience from the past? Oh, we cannot hear Dr. Lee.
I think you have muted my micro. Can you hear me now?
It's working now.
Okay. So I must say I'm really impressed about Ms. Young's presentation. I personally think I mean your system and organization, I must say it's best in the world. So let's talk about our country as well. So basically the impact of SARS wasn't that big in the past for Korea, but with MERS we had a huge hit from the incident. So we did have KCDC in the past, but the body was not that strong. But after MERS in 2015, we have strengthened our function and the role of KCDC. So we increased number of personnel in the organization. We have gave them more power in this kind of situation. And also we have started all the exercises for this kind of cases as well. And the other thing was that we didn't have that much negative pressure isolation units or PPEs or have set ready for this kind of situation. But after MERS in 2015, government mandated many hospitals across the country to have their some of their facility to have negative isolated rooms, just to prepare for these kind of situations. Mm-hmm. And the other thing is there was some law set up for this situation as well. So, for example, which I explained earlier about the approval process, for this kind of situation, time is essence. We cannot just wait for 6 or 1 month to get all the medical kit or the drugs to be approved. So after that, the 2015, we have set up a certain rule for the expedited approval process, and at the same time, for tracking and contact tracing, we also set up a Infectious Disease Control and Prevention Act, which can enable government to collect this private data. So I think these are some of the changes our government has made after MERS. And after this COVID-19, I think there will be more changes as well. I think we have expanded our personnel, but still we are still lack of investigators in KCDC. So I think government is trying to recruit more and more EIS officers for this kind of situation, and also increase their power of KDC after this.
Mm-hmm. Thank you for your explanation. By listening to your answers, the most important thing is that we believe is both countries, they have very swift decision-making process. Of course, we have a similar experience in the past, but even before the first outbreak, which was announced on around 20 January, both the countries already have started, or they've started the infrastructure in the past already. But anyway, if we don't have the support system from the government in terms of making decisions, maybe we cannot implement in a due course. So do you have any specialized process regarding this? Can I ask Dr. Lee first?
So if I understood your question correctly, so if there is no strong government support and a system, what should we do? Is that your question?
Yes.
So I think I mean, our CRK, we were lucky to have those systems of government, but if not, I think there's still something we can do in this kind of situation. So I think the older system and the PP and everything is all important, but I think the more important thing is that the people's awareness and how they act to these situations. First, I think if we do not have those kind of setup, what we can do by ourselves will be wearing mask and washing hands and doing social distancing, and especially when they have symptoms, just don't go out and just contact people. I think these are very simple, but I think this is essence of control this kind of endemic situation.
Mm-hmm. Okay, thank you. Can I ask to Ms. Andrea?
I think without the government's effort into this prevention system, it will be a disaster. Things will go out of control, and people don't have sufficient information, and most importantly, the medical resource that includes financial supports. That's the most important part of the entire prevention system. I think throughout this time, we see a lot of private sectors or academic experts. They're willing to join to fight against COVID-19 together. But the leadership and commanding center plays the most important role to tell everyone what to do step by step. And they have different operation procedures in different times. What I mentioned earlier in the presentation, right after we identified the suspicious case in Wuhan, there are thousands of things that we need to activate, and to align the government will be the hardest part. Not to mention when if it doesn't exist, you would see that people go out to the street without protections, without knowing what to do, or maybe robbing time and room for daily life supplies in a supermarket. Everything will be in chaos, just like what the movies would play in all these disaster movies. So I think there is no second option but demand high efficient governments during a difficult time like this. And it would need to continue to play strong roles, not just at our domestic levels, but also in the international levels as well. Because apparently this is a global disaster that nobody can get away with it. So the next stage, if we survive from COVID-19 in this wave, and let's hope it will go away. But if it doesn't, I think the international society would need to talk about not just, of course, domestic government efficiency is important, but we need to raise it to a higher level for the well-being and survival for human beings.
Thank you for your explanation. Could you come closer to the microphone?
All right, sorry.
As your voice is small. Thank you. Okay, the next question is, I think one of the successful points in these two countries is the digital technologies help. Without the digital technologies, maybe you could not trace the infectious people, but thanks to that you have the advanced technology, it was controllable. But the thing is that this tracing individual things developed the issue, such as the government surveillance versus individual privacy. So that kind of discussion agenda was kind of like become like common agenda in some countries. So we'd like to ask, what is the reaction from the public in your country, and what's the mainstream opinion for this? Can I ask Dr. Lee?
So, I mean, that is a huge issue. And actually, as I mentioned earlier, our government can trace people by using this credit card data or cell phone data or DUR data or GPS. Is possible? And actually, we were criticized by some of Western countries for privacy issues. So, I mean, there are issues I have to admit, and sometimes I think the level of information to release to public is sometimes too much, because some of our provinces just clearly, say whereabouts from the time and there, and even their age and everything. So some people think that we should definitely control the level of information exposed to the public, but collecting the information itself for controlling this infection, I think still majority of our people think that it's necessary to control this situation, but only that we should limit the information. Let's just share the very essential information and not share too much, so that it can jeopardize privacy issue of these people.
Okay, thank you. Can I ask to Ms. Andrea?
Yes, technology certainly plays a very important part in this few months, that the government has to quickly satisfy the demand of the public needs. They need quick information, and also they need to know where to queue for face mask when nothing was certain at the beginning. And we later need to come up with a platform that allows people to use their national insurance card to order and get their face mask. At the beginning, there's a link, electronic link in the national health insurance certified pharmacies, and all the pharmacists, they help to distribute the face mask. So without this this app or this platform, people would not have access to collective information and clear information as well. So this technology is one side, help the citizens to be comfortable of their daily practice. And secondly, it would be what Dr. Lee just mentioned, the digital footprint, how to track down the people, the individuals, without violating their privacies. It is definitely a dilemma in a time like this. But since we raised this level as a national security level and treated as a war situation, then we inevitably need to protect the citizens, healthy citizens, sorry, and also the confirmed cases from being infected again. So technology helps, but there are some ethical or moral issues that we will have to go in depth after we successfully contain this outbreak. But right now, I think we have a huge demand on advanced technology to help us not just get information, but tell us what to do and instruct us with the fastest way and rapid way to get through. So I think it gives people a sense of security as well. We have this high-tech information, high-tech systems to access information.
Yes, thank you for your answer. I think this is the first time for our generation to face this kind of dilemma. You know, we have such pandemic in the past, like Spain flu in 1918 around the time, but they don't have digital technology like this. So yeah, this is the questions that we have to deal out in the future, I think. And we have a question from live chat. This question goes to Ms. Yang from Professor Ghosh, India. He asked, do you think the way India is managing COVID-19 is doing well? Is there any scope to improve? I think he's asking the questions about the 6 pillars, the Taiwanese 6 pillars, and Ms. Ma Tan, she also asked the questions about 6 pillars.
Right. To be honest, I feel for India because the system that we're building is right after SARS, and it took us 17 years to come up with a relatively solid foundation. But with the scale of our population and land, it took us already 17 years. I cannot imagine a large country like India would need to do so much more and to do so much more work to ensure the containment of the outbreak. When I saw this on TV, the situation was reported in India. We just simply just cannot imagine if we implement the same system. How effective it would be. But I believe that if the government started to customize a system that fit for India, then in terms of its huge population and probably public medical system, because I'm not familiar with the system there, but it's important to prepare for a solid foundation, not just on governance, but also on the national health service level as well.
Okay, thank you. Can I ask the same question to Dr. Lee as a physician's perspective? Do you have any comments?
Okay, so I'm not really about the policy itself, but Ms. Yang already explained, I think, important details. So just from the physician standpoint, I have always same answer for this kind of situation. So, I mean, even in Korea, let's say there was some people who are diagnosed COVID, who were having this COVID-19 virus, and they were contacting a lot of people. But luckily, there was no spread from the people when this person was wearing all the mask all the time and keeping the social distancing. So I think for the huge country like India, I think it will not be easy to just start, all sorts of policy and using this all the techniques that we are doing in here in Korea or Taiwan. But I think the simple things can be done as well. Still, just having all the people wearing masks outside, and then when they come home, they just wash hand and keeping social distancing. I mean, these are very simple and very. It sounds easy, but I think this is actually the essence or core of controlling infection, and I think that's the first thing they can do at any time in India.
Mm-hmm. Okay, thank you. We had another question. A professor from India, he also asked, like, when do you think the second wave will come? But I think this is kind of difficult questions to answer because everybody says the intervals of infectious disease, like from 2003, 2009 bird flu, 2015 MERS. So the intervals between those diseases getting shorter. So the experts said that maybe we're going to have more often in the future. So maybe you can provide some of your ideas in terms of the second and third pandemic. And yes, how do you think about the next pandemic then?
So I will start first, Ms. if I may.
Okay.
So I think the question itself, I mean, there seems like two questions. I mean, we never know when the next pandemic will come. We never know about that. But I think the professor's question is more about the second wave of this COVID-19 itself. So I think this COVID-19 is very different from MERS or SARS, even different from the Spain flu in the past, because this is not as deadly as SARS or MERS, but still it does not have seasonality like Spain flu in the past. So basically, people talk about second wave, but I think probably just first wave may not just end and just go on and on and on and like this. And for even country like Korea, which we think we have controlled the first wave, but now there are still small outbreaks coming in and out, and we really don't know which one is second wave. Maybe we're gonna just experience small second wave all the way through until we have the vaccines, because experts firstly they expected this might have some seasonality, so this disease will just kind of go down during the summer, and the second wave will come back in later on in winter, and that's many experts were saying, I think probably 1 month ago. But I think situation is different. I don't think there's that much seasonality, because things are happening in Singapore, even like country with a warm temperature. So I think second wave can happen anytime, and I think even Korea, with this more outbreak happening here and there, I think second wave can happen anytime if we just loosen our the guard for this COVID-19.
Thank you. Ms. Andre, would you like to add?
Yes, I just want to mention that SARS just disappeared without knowing why. And up until now, I think the vaccines are still available. So we need to be extra cautious over COVID-19, what this will lead to. But like what I mentioned, that over the past 17 years, we have been trying to stay ready for pandemic disease hit like SARS and COVID-19. So let's just say it will come back anytime, and it would probably be there. And if we are not lucky, it won't disappear, and it will become things like pandemic flu, like a lot of doctors have predicted. So if this second wave will probably come back after all the airlines begin to operate business and people begin to travel at the global level, then that might be a time that we need to worry. But before we worry, we need to stand ready and change our daily habits, wear your face masks all the time, develop a good sanitization habit to ensure that yourself and your family and people around you are protected.
Mm-hmm. Okay, thank you very much. And I have another question. I think this goes to Dr. Lee, because we have many infectious cases all around the world, but the thing is that the most valuable assets and needful assets would be the medical staff. They're the most important needed resources now, but the thing is that they're more likely exposed to the virus. And in Spain and Italy, 20% of the infectious cases are the medical people. So how do you protect their safety or a kind of their rights? Because they cannot go to toilet and they're sacrificing a lot these days. So how do you think about the problem?
So I think this situation, I think just answer is just the same. Just keeping the principle is most important. The reason why a lot of people, a lot of doctors, health professionals were getting infected in like Italy or other part of countries that they did not have proper or enough PPE. I think the situation is different here in Korea and Taiwan. I think we do have some number of healthcare professionals who get infected, but it's very minor because basically the proper PPEs were all provided. So I think probably it won't be possible for every country to be equipped with all the PPEs in ready, but I think that's the first key to protect healthcare professionals. I think there's no other answer to that. And I think the second thing is also the civic awareness as well. I heard some stories where patients were not clear about their symptoms, or there might be very highly, they might be contacted they have high risk for COVID-19 and just contact healthcare professionals. And a lot of healthcare professionals will just got infected without knowing why. So I think the second thing might do is that raise the civic awareness so that if people have symptoms or they're high risk for this COVID-19, they shouldn't just directly contact this healthcare professional as well. So I think first, definitely have PPEs. That doesn't have any other alternatives, and having more raised civic awareness will protect our healthcare professionals.
Mm-hmm. Okay, thank you. Due to the time constraints, maybe this would be the last question, I think. This is kind of casual question. Maybe you can expand your imagination and you can answer whatever you want. How do you think about the pandemic change the way people live? Like it could be economy, it could be architecture, it could be anything. We just depend on your insights. So can I ask to Ms. Andrea first?
I think in every way. For example, when the outbreak first hit Western society, we strongly advise our friends in the Western countries to wear face masks, and also our people who live overseas in Western countries. But I think somehow wearing a mask, walking in the street is considered a bad thing in Western societies. And people who do that were discriminated, or they were not being treated very, very nicely. But look at the world now that people understand the differences of wearing masks or no. So the way that people live and the concept of changing our daily practice, for example, you develop a habit to wash your hands all the time and to change your hygiene habits in a daily manner. And I think this goes on as a global issue and maybe become a norm afterwards. And also in terms of financial security as well, there are so many people who lose their job, and there's huge economic impacts in many countries who are hit severely. So the government's operation as well and our personal financial security needs to be rethink and to come up with a different lifestyle that would allow us to survive in a time like this, or to do our best not to get the virus on us. But in Taiwan, I'm not sure in Korea as well, and also around the world, that by wearing face masks, not only keep yourself out from COVID-19, in our clinics or hospitals, there are figures showing that people who are infected with flus or cold are dropping. So this personal or public health change of curves would lead to probably a different generation of how we see the world and how we treat the planet. You see a lot of lovely animals coming out to the street when all the factories are cease working. So this is a time for us to review our human activities as a general and ongoing discussion in the future.
Mm-hmm. Okay, thank you. Can I ask to Dr. Lee?
So I completely agree with Ms. Yang for all the things she just mentioned. I think just I'm gonna just talk about the medical standpoint. So I mean, wearing mask, I think it's gonna be just part of our way of life, and more strict sanitization, personal sanitization will be also the part of our life. I mean, just like in Taiwan, same thing happened in Korea as well. During this winter period, we usually have second wave of influenza outbreak, but actually it really did not happen. And we see dramatic decrease of people going to clinics for the common cold as well. So just having this mask all the time and having more precautious personal sanitation is really working well and really decreasing number of infectious disease this time. So I think it's going to be really part of our life from now on. And second, now the medical system now feel that we really have to prepare for this kind of situation. We can't just have this situation unprepared. So there will be more resources and money and finance will be put into a medical system just to prepare for those kind of situations. Because if you have seen this in Western countries, it's too late. Just tackle this situation after it happened. So I think after this COVID-19, a lot of countries will have to invest more and more for medical resources for this kind of situation.
Thank you. So to sum up today's discussion, because there's just one point that I can remember from the governments in RC and RK, because the two governments, they really pinpointed the keys, which are the transparency, information sharing, openness, and listening to the experts. They really emphasize these factors, because this basically means the trust to the governments, and the trust will attract the voluntary cooperation from the public and the private sector, private businesses across the country. And this shows the process for establishing the leadership, because we believe that leadership is not just an outcome, but it's just a process that's seeking the approval cooperation from the public, because the voluntary stuff in terms of this kind of infectious disease is the critical point to manage. So that was the things that we can find in common in both countries. And the other thing is that they really learned from the past experience, because many countries, what they are doing now is they are struggling with infectious disease now, which is that the countries experienced in the past. They are losing the lives of their loved ones, especially the weak and the old people. And now they are learning how to be prepared for this kind of pandemic. And this is why we're here today, watching this APOP talk now. And this is why we're inviting the tourist speakers from RK and RC. So we really wish our viewers will share this video with their colleagues in hospital, medics and staff and government officers. So before we close, can I invite the speakers to leave conclusion message to our viewers? Can I invite Ms. Andrea first?
Right. Thank you. Like what I mentioned before, fear would be our worst enemy over this a difficult time like this. So we need to stay strong and learn from the past. But I have to say that government has full responsibility in a situation like this. There's no one else can be in charge and to help the people to go through difficult time. So people cannot be on their own, but in return, the people will need to follow what the government has to say. So to increase the efficiency and effectiveness of the government's role is extremely crucial. If a country that doesn't have a system, then we need to start now, because that's what we can share from Taiwan's experience. We suffered first, and then we rebuild, and then we try to survive, try to come up with something sustainable that can help more people to live. I wouldn't say that COVID-19 would be the worst situation what we have now. There might be some deadly, fatal virus in the future ahead. We don't know. And there's this uncertainty. We cannot just put our lives on the bet. So all the governments around the world and people around the world, that you would need to demand the government to work as fast, as quick as possible to build up your own system, that all individual countries to build their own system and collect information, collect data, and share with each other, then I believe that the world, the public health would be a lot stronger, and we will not need to live in fear as our experience goes.
Okay, thank you. Can I ask to Dr. Lee?
Let me pull up. Okay, so I think the preparedness, government leadership, and having great healthcare system, I think they're all important. But I think to put it all of them together, I think I want to underscore that the very high level of civic awareness and volunteer cooperation is still most important, because even we have the most perfect system, but it will not work if, let's say, people do not report to be tested, and they do not self-isolate, or they do not just keep social distancing in general. So I think nobody knows now when or how will second wave will come, or even next some new type of pandemic will come. But now actually Korea is facing a challenge again after easing our strict social restriction. There's some of a small outbreak is happening, and we never know how it will span out. But I think one thing is still clear. Now we really have to live with this new normal way of life, which is wearing a mask, or having more just personal sanitization. But most important of all, to really implement all these policies and to fight with the disease, we really need to maintain our high level of civic awareness. Thank you.
Okay, thank you. I agree with you all. Totally agree. And now it's time to wrap up. So thank you very much for our research speakers for joining us today. And I also thank you to our viewers for joining, and please stay safe and healthy. And we hope to see you again in another PE talk. And we wish the best luck to get through the situation wisely. Thank you very much.
Thank you.
Thank you.